Thank you for the opportunity to discuss our work on blood-brain barrier modulation with focused ultrasound for trastuzumab delivery in patients with HER2-positive breast cancer and brain mets. My name is Yang, and I'm from Dr. Lipsom's group at Sunnybrook Hospital in Toronto. Breast cancer is the second most common type of cancer. 20% of patients have tumors that overexpress HER2, which makes these lesions responsive to trastuzumab-based therapies. The development of intracranial metastatic disease, or IMD, results in worse morbidity and mortality. The management of IMD is through radiation and surgery, as the penetration of trastuzumab, which is an antibody of about 145 kilodalton, through the blood-brain barrier is very limited. Because of the risk profile of radiation and surgery limits the chronic application of these modalities in the brain, there is an urgent need to find other treatment that can be safe, more safely and effectively implemented. Transient disruption of the blood-brain barrier with focused ultrasound microbubbles for the purpose of trastuzumab delivery has been extensively studied in rodents. On the left is one study that showed Herceptin in the tissue that's sonicated can be enhanced from undetectable levels with focused ultrasound, and the tissue concentration is correlated with acoustic pressure applied. On the right is another evaluation using injected tumor cell models showing greater radiographic tumor response as a result of focused ultrasound plus trastuzumab as compared to controls. Our objective is to develop a non-invasive means of brain delivery of trastuzumab-based therapies in patients with HER2-positive breast cancer and IMD. A means of delivery that is safe, effective, and can be feasibly integrated with their standard chemotherapy regimen. To do this, we designed an open-label, single-arm pilot study in patients with HER2-positive breast cancer and IMD, aiming to enroll 10 patients and having patients undergo focused ultrasound procedures overlapping their standard trastuzumab or trastuzumab-based regimen for up to 6 times. Unique to this study is that we will be studying what is the effect of focused ultrasound-induced BB opening on the biodistribution of trastuzumab in the brain. Through Indium-11 radiolabeled trastuzumab, we'll be acquiring SPECT studies before focused ultrasound with injection of radiopharmaceutical, and with the first focused ultrasound procedure with injection of radiopharmaceutical at that time. We'll be following up the patients in terms of safety and preliminary efficacy measures during standard of care clinical assessments and MRIs for up to 24 months. We've so far enrolled 2 patients, and here is some of our preliminary results using the Exablate low frequency device. We have successfully opened the blood-brain barrier in the tumor and the surrounding regions, as shown by the increased gadolinium leakage on T1 weighted MRI. So our prelim data shows successful sonication of cerebellar lesions in patients with HER2-positive breast cancer and brain mets. And these patients have tolerated procedure very well. And the SPECT analysis of the radiopharmaceutical signal that as a result of focused ultrasound is ongoing. Finally, I'd like to acknowledge our collaborators as well as financial support from these agencies that have made the study possible. Thank you for your time.